everyone to today's program, Sacred Minds, supporting brain health and tribal communities on behalf of the Alzheimer's Association and our important indigenous community impact group and our constituents who really thinking strategically about getting resources to all communities. I'm so excited about today's conversation. So much to unpack in thinking of brain health in tribal communities. So much opportunity, as it pertains to new diagnostic tools for Alzheimer's, new treatments, that slow the disease progression, and then we just found out a couple months ago about the importance of lifestyle factors when we heard about the results of the U.S. Pointer trial: diet, physical activity, staying cognitively engaged. So much information, so many resources new resources in this treatment era for Alzheimer's and other dementia, and so many contextual, I think, considerations as we think about equity. Where do people live? How do they access information? Who do they trust, to receive information? And that's why this work continues to not only be important, but fundamental to the mission of the Alzheimer's Association and our vision, of a world without Alzheimer's and all other dementia. And in that world, we know that tribal communities are sometimes under-resourced by our outreach and disproportionately affected by Alzheimer's and other dementia, making this urgent, making this discussion very important and very timely. And so big thanks to our speakers who have taken the time to join us today to have this discussion, our partners who continue to trust us to create resources that are culturally relevant, trust us to be partners, in this pursuit of health equity in brain health in tribal communities. And so I'm excited, and big thanks to Edie Yao, Senior Director for Diversity, Equity, and Inclusion on my team, for continuing this momentum and continuing to move this work forward. And so looking forward to a great discussion, and I will sign off there. But thanks to everyone for participating, partnering, joining, and let's continue to move this work forward. Thanks, Edie.
Thank you, Dr. Hill. Well, let me add my thanks to everyone for joining, and happy National Native American Heritage Month. We're so thrilled to be celebrating during this month of November. 1 in 6 Native American adults age 45 and older report experiencing memory or thinking problems that might be a sign of dementia, and yet they often have less access to health services and timely diagnosis. While the Alzheimer's Association works to engage American Indian and Alaska Native populations throughout the year, this is a month that offers us an opportunity to dedicate some time to highlight progress made in tribal communities while promoting brain health and culturally relevant resources that the Alzheimer's Association offers. So, as Dr. Hill said, this is a pivotal moment in the landscape of Alzheimer's and dementia. There are more advances today than over the last 100 years, from risk reduction to diagnosis to treatments. And so what we learn and what we're learning about brain health is that it's so important, and that it's never too late and it's never too early to do things to protect our brain. And so it's critical that we're ensuring tribal communities are informed and prepared for what's to come, to the health and well-being of Native people. And so we're really proud to partner with a number of national and local organizations to bring dementia-related resources to tribal communities. So thank you for joining us. And Here with me today are several individuals to share their work in the dementia space. And so we have Dr. Maria Bellantoni here from Indian Health Service. She is the IHS Chief Clinical Consultant for Geriatrics and Palliative Care. We also have Ashley Littlewolf, the Executive Director of the American Indian Public Health Resource Center at North Dakota State University. And we have Amber Hoon, who is the Senior Public Health Specialist, the Great Lakes Intertribal Epidemiology Center, and also a road champion. And we are hoping to have Billy Tohi join us, who is the Executive Director of National Indian Council on Aging. She is off-site right now, perhaps at a place where Wi-Fi connection may not be great. So she was going to join us at the beginning, but we're hoping that she will be able to join us at some point during our webinar today. So with that, I will go ahead and turn it to Dr. Bellantoni to tell us a little bit more about Indian Health Service, the programs and resources that you are all providing. And I will share your slides. There you go.
Perfect. Thank you so much, Edie. And it's such an honor to be here included in this panel today. So thank you for the invitation. As Edie mentioned, I'm Maria Bellantoni, and I'm first and foremost a primary care physician and geriatrician. I have the honor of caring for Native older adults at the Phoenix Indian Medical Center. And I also serve as the Indian Health Service's Chief Clinical Consultant for Geriatrics. In that capacity, I work with the IHS Alzheimer's program team as their physician consultant. And I am so excited today to share an update with you on our federal programming that aims to optimize the quality of life and longevity for older American Indians and Alaska Native people, especially those that are living with cognitive impairment, their caregivers, and their families. Next slide, Edie. Thanks. I'd like to begin with a reminder that the IHS mission is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. And I'll add that we are very privileged in the IHS Alzheimer's program in that our work really touches on all aspects of this mission. A little bit about the beginning of our program. So we first received congressionally appropriated funding in 2021, so relatively recently, to address the growing need for Alzheimer's and dementia care in American Indian and Alaska Native communities. So through the tribal consultation and urban confer process, we were able to structure our programming with and for tribal and urban Indian leaders, and we're really proud of that. Our work is designed around 4 priority areas, which are listed here in our graphic. The first is program awards and grants. We fund innovative and culturally relevant models of care to improve dementia services. I'll talk a little bit more about that in a minute. We've also stood up a really robust education, training, and workforce development program in collaboration with agencies, tribes, other organizations, and communities to really offer a wide range of training and education opportunities. Additionally, we see a really important part of our work is, like the Alzheimer's Association, increasing outreach awareness and engagement around dementia and cognitive impairment issues. And then certainly a part of our program is just data, technical assistance, and program support to keep all of our operations running. So all of our funding and our programming falls into one of these 4 categories. And I'd like to highlight a few of the things that we're working on today in that regard. I'd be remiss if I didn't mention the rest of my team. I believe some folks are joined us here in the audience. A really fabulous group that represents a myriad of skill sets and expertise located across the country. We have our leader, Nicole Cottier, who is the Community Health Branch Chief and Acting Director of the Division of Clinical and Community Services at the IHS headquarters. Our National Elder Services Consultant, Dr. Jolie Crowder, our Elder Healthcare Data Coordinator, Valerie Jones, and also our Management Analyst, Jamie Olson. So I'd like now to take an opportunity to highlight some of the initiatives that fall under our various focus areas. One of our priorities is to provide funding directly to tribes, and we do that in a really innovative way through our Dementia Models of Care grants. Really excited. This is sort of a new debut of this map, this graphic, and we're really excited because since the first funding opportunity that we provided in 2022, we've awarded over $7 million in grants to enhance Alzheimer's and dementia care within tribal communities. And our program has now supported 18 tribal sites, and as you can see in the map, it's spread across the entirety of the country. We're really excited this past funding cycle. We were excited to welcome the Chickahominy tribe in Virginia to represent the East Coast. So we really do have the full coast to coast country covered now in our grants. Our models of care grants are unique in that they combine local knowledge of communities and culture with technical assistance and expertise from our federal team and our partners. And this has really led to a partnership that empowers tribal organizations to create tailored, culturally relevant care programs that address dementia needs in their communities. These photos here demonstrate some of the ways this is being done. On the left here is an older adult receiving care in her home through one of our dementia grant programs. And on the right here is an example of a community event celebrating brain health with mindful activities. So again, it's an exciting platform for tribal communities to really be empowered to create solutions for their own communities with expertise that we can collect and gather at the national level. Our second aim is to increase the capacity and expertise of the federal, tribal, and urban Indian health systems workforce to better care for Native elders experiencing cognitive impairment. We know that a prepared and well-trained workforce results in better outcomes in care of older adults. So we've embarked on several new and continuing initiatives in support of this goal. Just in the past few weeks, we're really excited to have launched the IHS Dementia Care Pathway, which is the first IHS-specific tool that helps clinicians detect, evaluate, and diagnose dementia. This is exciting because it's really meant to be an easy-to-use clinical tool to help providers caring for Native older adults recognize and ultimately diagnose dementia. We know that's really the first step in getting good care. And really, this tool is meant to be used regardless of practice location. We know that our health system embodies a wide range of diverse settings, whether it be rural, urban, or somewhere in the middle. So really, this tool is meant to be used sort of in myriad ways by all clinicians that are in the system. It is now available on our website, so we hope that this is of use to our clinical teams that are working in this space. Also, we're excited to provide a support line for clinicians who are working in Indian health settings. This is actually manned by our contractors at the University of Washington. And again, it is a warm clinical line for clinical teams that are caring for patients experiencing cognitive impairment. It's a chance, we know many folks practicing in our system do not necessarily have immediate access to specialty care or consultation. So this is one way that we're making that expertise available. And again, information about this is on our website, but we are making it available Monday through Friday. And again, it is staffed during these hours, and we really welcome your questions and clinical concerns to better help and care for older adults experiencing cognitive impairment. We have two direct workforce enhancement programs within the IHS, the Jerry Scholars Program, which is now in its fourth year, and the Geriatric Nurse Fellows Program. These initiatives are cohort-based training opportunities where participants receive really dedicated didactics on elder health and dementia topics, and then also undertake a mentored and geriatrics-focused improvement project in their clinical setting. This has been really one of my favorite ways we've continued to grow our network and champions for elder health across the Indian Health Network. We realize again that sort of the first step in improving care for dementia is to increase recognition and detection. To that end, we've actually created a set of training videos on the MiniCog screening tool, which is used to detect cognitive impairment. And we've actually supported 2 rounds of pilot programs to train community health representatives working with tribes in this tool. These are also available on our website now. And I'd be remiss if I didn't mention our wonderful partnership with the Northwest Portland Area Indian Health Board, who has been, over the past few years, really helping us produce some really high quality and excellent echo or extension for community healthcare outcome sessions. These are virtual platforms for knowledge sharing on a health topic. We actually offer 2 different echoes through this partnership. One is for clinicians working with patients experiencing cognitive impairment, and then also one dedicated to caregivers. And last but certainly not least, we're excited to announce a new resource that we'll be launching in the coming weeks. This is a really comprehensive set of dementia training materials aimed at all disciplines within the healthcare system, all disciplines, all workers within the healthcare system. Again, developed in conjunction with our contractors at the University of Washington. These trainings will cover a wide range of dementia topics, and they will be offered in several different platforms, really trying to make this widely accessible to anyone who is working with Native elders. We will be offering live sessions as well as asynchronously through our learning management platform as well as on our website. Again, we're really excited. This is a really comprehensive and extensive group of trainings dedicated specifically to folks working with Native older adults. So really excited to make this available in the next coming weeks, and we hope that many of you will be able to join us in these trainings. Just a quick additional updates for you sort of regarding our goals of outreach and awareness. This coming March, if you don't mind, Edie, next slide. We will be hosting the IHS Clinical and Community Workforce Summit this March in Denver, Colorado. And we have really some exciting additional initiatives coming down the pike that we hope we'll be able to share with you. But we really also welcome the opportunity for partnership and idea sharing. So we hope much of this can be done at this summit in March. So we invite you. Registration is free, and more information will be made available as our website gets updated. We really, again, hope to see many of you there to share ideas, to learn from us, and you to learn from you as well. So we hope you are able to join us for this. And again, more information will be made available in the coming weeks. We love keeping in touch. Again, we know this is how we grow our networks and our partnerships. So we really invite you to reach out and connect with us. We have several ways to do that. We've newly updated our website. So a lot of the resources and materials I discussed today are available on our public website. The QR code on the top will lead you there. We also have a listserv and a biweekly newsletter with some really great updates on our programming, ways to get involved, funding opportunities, as well as some, just updates on general dementia care and research going on throughout the country. So if you would be interested in hearing from us in your email, please sign up for our listserv. And certainly we welcome feedback, questions, ideas, discussions. Our program has an email address listed here at the bottom. And again, we welcome the conversation. So that is all I have for you in terms of an update. Thanks so much for the opportunity to present. Again, we're really excited to be here and continue the conversation. We hope we see you all in some of our ongoing programming and perhaps at our summit in March. Thanks so much, Edie.
Thank you, Dr. Bellantoni. It's really so encouraging to see the progression of all that Indian Health Service has been offering in this space. And I think you've provided some really great resources for us to all take a look at. So thank you so much. If you have questions, please put them in the Q&A function, and we'll make sure to address any questions at the end. I see that we do have Billy Tohe joining us, so that's great. Billy, glad you were able to join us. We're going to go to our next speaker, Ashley Littlewolf. Thanks, Ashley, for joining us. And I will give you an opportunity to introduce yourself further while I set up your slides.
Yeah, thank you, Edie. Bonjour, everyone. My name is Ashley Littlewolf. I'm an enrolled member of Boys Sport Band of Ojibwe, and I currently serve as the executive director of the American Indian Public Health Resource Center. And so, happy Native American Heritage Month. Like I've been saying all month long, every day is Native American Heritage Day in my mind and for all the relatives across Turtle Island. So, Miigwech, thank you for having me today. And Miigwech for pulling up the slides. And so I'm just here to share about the work that we do here at the American Indian Public Health Resource Center. Long title. We'll refer to it as the center as I'm talking sometimes. We are housed within North Dakota State University in Fargo, North Dakota. And so with that, I wanted to share today just on some of our work walking alongside the Health HBI Healthy Brain Initiative Roadmap Champions, and then also talk a little bit about capacity building and some of the work that the center does. And so to start us off, just to share the mission and vision of the American Indian Public Health Resource Center. So our mission is to address public health disparities through assistance, policy, self-determination, analysis, education, research, and programming, partnering with tribes across North Dakota and the Northern Plains and the nations. And so the center was really founded to address long-standing gaps in tribal public health systems through a variety of efforts like workforce development, research capacity, and culturally responsive programming. And so we are housed at North Dakota NDSU, but we really walk alongside our tribal partners and communities as a respectful partner, recognizing that tribes hold their own expertise, priorities, and solutions. And so our commitment is very simple. We support tribes in designing, governing, and growing their own public health systems on their terms. And so the center is guided by our tribal communities, and we really are here as a gift and an honor to walk alongside those communities that select to work with us. So I feel really honored and gifted to be able to be doing this work. And yeah, next slide. I just wanted to talk through, so we have a medicine wheel for a logo, and so that is a four-pronged approach. And our team has gone through some transitions, but we are still focusing on these four different areas as a center. And so I won't read these word for word for everybody today, just for sake of time. But so focusing on research, and as most folks are probably aware, and maybe not, that data sovereignty is very important to tribal communities and especially for tribal health. And unfortunately, tribal communities don't always have the access to or ownership and the sovereignty of data that is should be owned within that tribal community. And so if we are to assist tribes walking alongside them for research, we would be allowing and not taking ownership of that data and that research. That would be just supporting and building capacity for that tribal community. And so we are really resource centered for tribal public health. And then another focus area is policy. So in partnership with tribal nations, identify policy and resolution, research and development, and potentially develop advocacy and strategy goals. And services, that's another focus area for the center. And so working with tribes to strengthen public health services. We do have a toolkit that has will be uploaded onto our website soon. We are undergoing a revamp and editing of our website to make sure that everything is up to date. And so that toolkit was put together in conjunction with previous center staff and also the North Dakota Public Health Department. And so it's just how to conduct in a good way community health assessments. And so that's a service that we provide here through the center. And then improving tribal public health services. Again, letting tribal communities identify what their priorities are And so with those community health assessments, that helps to identify what those might be for the community. And then education, engaging with tribal colleges and universities, working with tribal communities in North Dakota for outreach and engagement, and potentially developing curriculum, depending on if that's what they're looking to do. So this is just a quick snapshot of what a community health assessment, the process that we follow. And I know it might be kind of hard to read. Again, our website, I have shared these slides, and I'm happy to have those shared out as well so that folks can check out our website. And I see Eva had put it in the chat as well, for the full toolkit and to kind of look through that process. But we do have a framework that we follow and a process that we follow to ensure we're being good partners and stewards through the process. And so what I'm here to talk about a little bit more is, and I know we have Amber on the as a panelist today too, and Amber is a champion through the HBI roadmap for American Indian Alaska Native peoples. And so it's been an honor and a gift for me to be walking alongside all of the strong and community-based champions. And so the center has been walking alongside to provide technical assistance, resources, and support to the Native or tribally led organizations that were awarded this year. And their focus areas were across risk reduction, caregiver health, education and awareness, but very strength-based in their community and immersed in their community. And so that's a brief overview of that. Next slide. And I won't take credit for this. I did not create this. The visual that we have here today, but I did plug that in here. And so this just gives an overview of where all of the champions are in their communities. And we, we'll be wrapping up that first cohort pretty soon, but the champions are really carrying out the impactful work to improve brain health in all of their communities through innovative community-led solutions and work. And so I just want to give a shout out to all the champions across Turtle Island that are on the map here. And so the capacity building, our approach to capacity building and recognizing that a lot of barriers and a lot of times organizations, nonprofits, potentially tribal nations and communities or urban organizations, they might not have the workforce data system, or their shortages, funding streams changing. And so sometimes capacity building can be the last thing that folks want to talk about or think about, but really the Resource Center tries to approach that as community-driven planning and sustainability focus. And so what's that long-term impact? Relying on partnerships and networks, bridging and connecting organizations and partners to each other so that they can continue the mission-driven work, community-driven work that they're seeking to accomplish. And I think the most important aspect of our approach is the respect for tribal sovereignty. And so all of our capacity building efforts align with tribal governance and cultural values. We would never approach a tribal community and assume what their specific, unique, diverse values or processes are, or where they might need capacity from an outside lens. And so really, we're in the passenger seat while the tribal community is in the driver's seat, or we might be in the back seat, and just providing resources and support and being flexible to what that might look like for that tribal community. And I'm not sure how we are on time, but for just a summary, and again, these slides can be shared out, so the center, I didn't get through all of our current projects, but just something to look forward to. And if you're interested, we do have a newsletter as well that goes out quarterly. Our social media pages, we try to share out any upcoming events that we might have, programming, any applications. And so what we can look forward to for the future of the center is to continue to carry our vision and mission to support tribal public health, continue to cultivate future leaders through our Indigenous Food Sovereignty Emerging Leaders Program, continue working to support healthy brain work by providing technical assistance, and then developing community-led healthcare toolkits.
Great. Thank you so much. Oh, was there more? Okay, great. Well, thank you so much, Ashley. What a great resource. And for more information about the Healthy Brain Initiative roadmap for American Indian and Alaska Native peoples, I'm sure we can drop that in the chat if we haven't already. So I'm going to now turn it over to Amber Hoon, who can talk a little bit more about her work as a roadmap champion, the work that her organization does. And through storytelling, like, really sharing how this is impacting real people out in communities. So, Amber, I'm going to turn it over to you while no, you have your slides actually. So,
I do, so bear with me, folks.
Yours, yeah. And again, if you have any questions for Ashley or Dr. Bellantoni, please put them in the Q&A and we will try to get to those after we have all our speakers present.
Can you see my screen?
I can.
Right on.
And then you can show your video as well so that we can see you too.
Okay. And how do I do that exactly? Oh, I got it.
Okay, great.
How's that? Oh,
Don't see you, but that's okay. Go ahead and we can figure that out later. We
all
can hear
right.
you fine.
Okay, right on. Okay, so Buju and Dinaway Amagani Doug. Money Dunipe Kwe Indigenous Migizi and Dodem. Milwaukee, Wisconsin, Gaye Kiskus and Dunjaba. Hostekos Gaye Anishinaabe Kwe. So hello everybody. My name is Amber Hoon. My Indian name is Manidunipe Kwe, and I'm Eagle Clan. I'm Hostekos by blood and adopted Soto. And I'm honored to be here with everybody today. I am a senior public health specialist and an LPN with the Great Lakes Intertribal Council Epidemiology Center, and that is a program of Great Lakes Intertribal Council, which is located in Lac du Flambeau, Wisconsin. Our service area actually includes 34 tribes located in Wisconsin, Michigan, and Minnesota, as well as 4 urban Indian communities. So again, it's wonderful to be here with you all today. So my aunties, they lovingly say that I'm kind of nosy, and that's their way of saying, and that I like to learn. As a child, I was nicknamed Boo because, while I didn't open my mouth much, it's hard to believe now, but I was told that I was always kind of looking around with my eyes wide open. And with that being said, I'm going to be nosy. Okay. I would like to ask everybody, like, what does brain health, why does it matter? Why is brain health important? And I know that we can't conversate back and forth and things like that, but if you want to maybe plug into the chat, just a thought about why brain health matters. While you're doing that, I'm going to kind of share with you why brain health matters in my view. For me, brain health protects that cultural knowledge and that Indigenous ways of living well. Strong brain health supports sovereignty and community resilience. Brain health's not only an elder issue, it includes all of those hills of life, all of those stages of life, and can decrease the risk of our younger ones and future generations developing dementia. And then, of course, if that brain health is not something that's supported or acknowledged or talked about, then that dementia can kind of sneak in and result. That dementia can, kind of come into play more. We'll see those higher rates and those higher incidences of dementia. And As many of us might know, that dementia does not just affect an individual, but also entire families and even communities. So some of, just a quick overview, and this is, definitely some of what we offer, but not all of it. GlideTech offers Train the Trainer and community models for the Second Wind Dreams virtual dementia tour, Savvy Caregiver in Indian Country, as well as Dementia Friends for American Indian and Alaska Native communities. We also offer workshops and presentations that are tailored to the topics and needs of individual communities. We do interactive brain health gatherings, and as I get a little further down, I'll kind of show you what that means. One-on-one educational support for caregivers, families, and friends that are caring for someone with dementia. Sometimes, when we have community events or community trainings, it's uncomfortable for people. And while they really still want that support and that education, it's more of something that they would prefer to do on a one-to-one basis. We also have a technical assistance program, and that's where our tribal communities can go ahead and request things such as survey creation, evaluation reports, outreach material, creation such as fact sheets and infographics and things of that sort. This is actually a statement that's very near and dear to my heart. I recall starting this work in 2020 and collaborating with a few outside folks to develop outreach materials. And, their idea of a culturally appropriate was sticking a dream catcher feather as a visual, on some outreach materials. There were also some wonderful American Indian resources that were already existed, but for our folks that are in our service area here in the Bemidji area, the imagery and even some of the wording and context was not relatable. It didn't really fit our tribal communities in this area. So I do like to say that the heart of GlideTech's Together Strong Tribal Brain Health program is cultural integration, not adding culture on, but actually embedding it in every step. So we're very conscientious of that in our work. This just talks a little more about that in our program model. So it is a culturally centered design, and this includes guidance from elders and community members, along with making sure that we're incorporating language and utilizing traditional ecological and land-based knowledge. Tribal governance, each tribe, we have that respect that they direct their own brain health and dementia initiatives and retains authority over their data and priorities. We're just there to be of support. Also, there's a lot of collaboration that happens in this work. So our organization works alongside a lot of universities, outside agencies, clinicians, and it's important that while we're doing those collaborative partnerships that we're ensuring that Indigenous knowledge, data, and content is protected and respected. We also are very community driven, as I'd mentioned above. Listening is the key to a lot of what we do. Instead of going into a lot of our communities with our, mouths kind of going, we go with our ears open. It's very important that we hear what our caregivers, what our community members, our leadership, our clinicians, all of our communities, what they're going through, and how it is that we can be helpful in a respectful way. So this is actually the very first time when we started this program back in 2020 that I put up a resource table shortly after the communities opened up early in 2021 after our COVID. And this was the first resource table that I ever offered. And I'm going to tell you that it was quite lonely. I don't know what it was. Maybe it was the topic. Then it was there, but it wasn't talked about too often. So when I put my table up, I seen a lot of elders and a lot of community members kind of side eye a little bit as they were kind of walking quickly past it. Um, but I do have to say that persistence was key and being present and again, just kind of putting it out there was very helpful. Um, but by 2021, we actually were able to offer our very first Train the Trainer training, Savvy Caregiver in Indian Country. And we were able to train 19 tribal staff from various communities within our area to be able to carry forward that training to caregivers within their own communities. Um, and also with the outreach, going back to that, it was kind of funny how things started. Like I said, it was very lonely. People were kind of, yeah, I don't really need to know about this. And then I got invitation to come and eat a meal at the elder site with some of the elders. And so I would go and attend the meals and sit down and we'd, just chat about things. And eventually it was, oh, so what is it that you do? And slowly we started incorporating, conversations into there about brain health and dementia. And one day I had this wonderful elder that had lots of questions, and we just started talking. And he said, I have two friends out there that I'm wondering about, and if they have this dementia stuff, and a half-hour meal turned into a 2.5-hour conversation, which then led to an invitation to go and visit with his friends. And, now in 2025, carrying it forward, we still have connection and we still have conversations. So. One of the things that we talk about a lot within our communities is music and that connection that music has to brain health. Also, socialization and avoiding isolation. So this is a photo of a round dance in our Waswaganing community, that's Lac du Flambeau. And this was their first round dance, and it was actually a very amazing event. And what I noticed when I was looking around was just the big smiles, the elders, the children. I mean, there were so many different generations present in that room and how that music brought everybody together. So this is a good way to incorporate brain health into community. I'm sure some of you are familiar with lacrosse. This is actually it's our indigenous version. So this, I want to say, and I don't have any historical fact to it, came out before lacrosse did. But it's not only fun to play, but it is fun to watch as well. And you'll see here that our players are, again, multi-generational. So we have young ones on there. We have a little older. We have all, everybody in between. And look at everybody's faces. They're just the expressions, I believe, on the faces really explain the value of this. And when we think in terms of brain health, it encompasses over almost every aspect of it, from movement to interaction to laughter to, just even if you're watching from the sidelines, which I do because I'm just not brave enough to play yet, but and having the elders at the sidelines. And one of the cool things when these guys play is that when they score a point, they get to pick a gift. And that gift is actually presented to one of the elders or the observers at the sidelines to actually kind of draw them in more and be, feel as if they're participating. This is actually a photo of one of our long lodges. So this is a space that we would utilize to share teachings, to get ready for some of our Meduduswan or sweat lodge ceremonies, have feasts, all different kinds of different things like that. And this photo might seem pretty simple to a lot of people, but when I look at it, I again see all aspects of brain health encompassed within this cultural activity. And by that I mean when you look at the walls and you see the saplings that create that wall, those walls of the structure. Those saplings were actually harvested the same day that we made the structure. So it included going out into the woods, identifying the correct saplings, because there's a certain type of tree that we use to build this structure. And then, honoring that sapling, putting down our tobacco, and saying the prayers that are associated with that. And then you have to haul this, cut it down and haul the sapling out, tie it to a vehicle, get it back to the, place where we're building the Long Lodge. And that's not even where it ends, Then you have to measure and we used old school methods for measuring and a little bit of modern too, but using a string and different things like that and learning those old ways of figuring out those things and problem solving, and then the physical labor that it takes to put the structure up as well. So this is an excellent example of incorporating culture through knowledge sharing and ecological knowledge, land-based knowledge. This is actually my son, Maue Makua, my second born, and my best friend and teacher, Gary. And this is, again, this is the building of that Long Lodge prior to the coverings being put up. So that's a good example of that knowledge sharing and just that intergenerational interaction and the importance of that. This is Gary again. This is my grandson, Chi Makade Makwa, and he was actually present there for the building of that Long Lodge. So Gary was walking him around and showing him things and talking to him about different things in that respect as well. Again, the facial expressions. I mean, just that interaction between youth and elder is, I don't know, it just hits me in the heart. Again, this is my son, Maue Makwa, learning how to ride his horse here. That's his adopted grandfather, Bobby. And again, just the importance of that interaction between our elders and our youth and that knowledge sharing. This is my uncle, Gnu Makwasaban. He's no longer here. And he was, him and my auntie Christine were two very important teachers in my life when it came to culture and living in a good way and in a respectful way. And I just felt the need to acknowledge family and the importance of family. In the work that we do with GlideTech, a lot of it involves family, right? We're working with caregivers, we're working with multi-generations, we're working with a lot of different families. So just to acknowledge the importance of that. Going back to that land-based knowledge, some of my work outside of work, if that makes sense, I do a lot of things for and with our elders outside of our traditional 8 to 4:30 jobs. And one of my jobs is to help to collect and harvest traditional medicines that are important to those elders or that they might be looking for that they can't get out on their own to obtain. So this is just a photo of that. And again, the importance of culture and being respectful of that. These are medicines that I harvested for many of our elders that they had requested and then processed. And none of this could have been done without that knowledge sharing from many of the elders and teachers in my life. So just the importance of that. One thing I like to mention is there's a lot of talk in brain health and dementia work about tobacco. And for a lot of traditional folks, tobacco is very sacred, and we lead with tobacco in everything that we do. So just to kind of put out there that when speaking about, tobacco cessation or, tobacco use and things like that, just to be mindful that for some of us Indigenous folks, it's very sacred, and to just be mindful about the way you're speaking about it. Um, this is a picture of a traditional kinnikinnick. This is actually red willow. There's a certain way that you have to process it to get that traditional asema, that tobacco. So this is a very beautiful photo. A lot of the times for some of us Anishinaabe, wintertime is a time for storytelling. We slow down quite a bit from a lot of other things that, we do during the warmer months. And it's a time to share stories and pass on cultural teachings and things like that. So this is a picture that depicts an outside storytelling. A lot of the times I get asked, like, well, why do you do this work? Why is this so important? And things like that. And I have a hard time answering that sometimes, but I guess in the simplest way is that, I really care deeply for our elders, for our communities, and not even just my own, but in general, and I do this work for our elders, for our veterans. I do this work to be able to continue to um, gain knowledge from our elders, but also to be able to impart that knowledge to our future generations. So much of that they tried to silence that, throughout history. And the importance of revitalizing that and being able to carry that forward is another reason why this work and brain health work is so important to me.
Amber, I'm just mindful of time, and I want to make sure we give enough time to Billy, our speaker, as well. So thank you
Absolutely.
so much for sharing these beautiful photos.
Sure.
Um, it's just and the stories that accompany them, and reminding us the value of culture when it comes to looking at brain health and making sure that we're thinking about it in culturally integrated ways, as Ashley had said. So
Mhm.
thank you.
Thank
Or actually, you had said that perhaps. Billy, are you able to get off mute? I
I
want to go
am
ahead and,
here. Can you hear
well,
me?
yes, I hear you. And so Billy Tohe is the Executive Director of National Indian Council on Aging. And I think a great segue to what Amber was sharing, which is, respect and value of tribal elders. And maybe you could speak a little bit more to that.
Sure. I don't know, Edie, if I'm having trouble with my video part of this,
I don't
but
see you,
I don't I
but
don't
I
know
can
how
hear
to,
you fine.
okay, I don't know
Yeah,
how to remedy it. I'm sorry.
that's all right.
But anyway, Hawaii P and Taros Agri Vorimitawe, Jawere Nutachi Agri Bohoje, Niki, Kradami, Haki Haji Ki, Tunapi Haki Haji Ki. Good afternoon, everybody. My name is Billy Tohe. I come from the Oto, Missouri and Iowa nations of Oklahoma. My Indian name, my traditional name is Kradami, which is real eagle woman, and I come from the Bear Clan of my tribes. I'm here in Muckleshoot, Washington today. Glad to be here. But Edie, I want to thank you so much again for including me in this webinar. It's an honor. And again, I apologize about the technical difficulties, but I also have a board chairperson here with me. She's from Alaska. Her name is Edna Riley. And we would just wanted to both of us touch on the tribal communities in our areas and across the nation who I've spoken to, which we did today, just recently. Today, I spoke with several other elders, and they voiced their opinions about the same thing that's going on to us with elders and actually in the communities. I come from a community in central Oklahoma. One of our elders we spoke to, she comes from Taos Pueblo in northern New Mexico. Another elder that we spoke to, she comes from the Tule River Reservation in California. And so I think that, and we all touched on the same basis, the same things that we feel that's going on in our communities. And I'll give Miss Riley the chance to speak on her community as well, as I mentioned. But it's what was spoken today was that we hear about things, or the ladies, the elders were mentioning that they hear about things that is going on with the Alzheimer's, dementia, all of the research, all of the things that is happening. And they are aware that things such as this are happening, webinars, studies, research, all of that. But for them, they voiced that it's not, to them, it's not actually right in their community as of now. And to me, that tells me that this is such a great opportunity to bring this awareness, such as this webinar, to those communities in the best way that we can. And as Edie had mentioned, you mentioned that I'm the executive director of the National Indian Council on Aging. And so, Edie, this just brings to light to me that we need to do as much as we can actually in the communities themselves. Yes, there are so many other issues such as funding and such as location, things of that nature, but to actually present this type of information right directly into the communities, to the tribal members, to the tribal elders. And as we know, dementia and Alzheimer's, among other diseases and things that affect our elders, they don't just affect the elders, they affect the entire family, and a lot of times the entire community. Such as one lady was speaking to me today about Taos Pueblo, to where not too long ago there was an elder that was just roaming around in her community, the Pueblo, and nobody seemed to approach her. She didn't approach for any help or anything, but it was determined that she does have starting to have symptoms of dementia and Alzheimer's. And that just tells me, Edie, that more dissemination is much needed, and that we're doing all that we can out here in the advocacy world, such as University of North Dakota State University, things of that in your organization, which is international. And that's what I would like to, really focus on now that I've spoken to several elders, tribal elders. And we are, even myself included, we are tribal elders. And yes, I understand what Amber was speaking about. And yes, I agree with her wholeheartedly that there are certain protocols when you do approach tribal elders in their communities, in their homes. And so I want to, excuse me, I'm sorry. I just want to encourage each and every one of our partners to continue the hard work that you are doing in disseminating this much needed information, education, and our cultural aspects of it are very important to us. So that's where I'm at. I personally, and the older I get, the more personal interactions I have with friends and relatives that are suffering with dementia and Alzheimer's. And there's a lot of variety of issues that surround that, such as caregiving. We need a lot more caregivers throughout the nation. We need, like I said, yes, and more dissemination. And I just think all of us put together that, well, I think we're making progress. On my flight to Seattle from Albuquerque, I sat next to a lady that was from Albuquerque. She said that her mother is 94 years old and she is starting to show symptoms of dementia, but with the help of medication. And I'm so sorry, I can't remember the medication. It starts with an A. That's all I can remember. But she said this medication is doing wonders for her mother. So even that is very, very important for everybody to be aware of. There are medications, there is research going on. So those are the important aspects of this dissemination of this type of, information that we need to get out there.
That's
So I
right.
just wanted to touch on all of these issues. There's such a wide variety when you do speak of dementia, Alzheimer's. As we all know, it branches out to many more areas and affects so many more than just the ill person. But anyway, I just wanted to give a few minutes to my board member
Well,
here. She's the board member
yeah.
from NICOA.
Okay. Well, we are just about out of time, but we can
Okay.
certainly I would
Right.
love to bring back our panelists on
Okay.
screen here and thank
Okay.
everyone for participating. I think Billy brings up a really important point, which is uh, making sure that we continue to share the resources available. And I know one of the questions that was asked from Q&A is how can we expand the training? Many of you have shared, training opportunities. How can we get that out to communities? Maybe we could just take 30 seconds if one of you wants to answer that.
This is Edna Riley. I'm on the Canada Chiefs Conference Health Board,
Yes.
as well as the National Indian Council on Aging also. And there is a lot of talk about there is not enough transparency for the people to know what to expect or what to watch for in people that do have the dementia or Alzheimer's symptoms. And I feel that they don't want to talk about it. Uh, it's nothing to be ashamed of, and we just need more transparency on that. So we have a radio station that a lot of the people listen to at home in the Alaska Native communities. So that was one of the areas that we reached out to get the message out about Alzheimer's and dementia.
Yeah, that's a great method of outreach is through radio. Thank you for sharing that, Edna. Great to
Yeah.
have you join us.
Thank
Yeah.
you. Thank
Well,
you.
I know we are out of time and we've had some people drop, but certainly look up IHS's website for additional resources, Ashley's organization as well, which is, if you could quickly say it because it's so long.
American Indian Public Health Resource Center.
Terrific. Thank you. And also Amber Hoon's work with GlideTech. Really appreciate all of you sharing that. And I also want to remind everyone that the Alzheimer's Association has almost 70 chapters across the country. So wherever you are and you are interested in learning more about our resources or wanting education out in your local communities, please reach out to us. We have an 800 number. It's 800-272-3900. This is our helpline that is available 24/7. And so any questions or concerns you have, please feel free to reach out and we can connect you to your local chapter. And we also have a website devoted to particular resources for Native Americans. It's alz.org/Native Americans. Really want to thank our panelists here, your partnership. We certainly can't do this alone. And so we welcome everyone to join us in making sure we disseminate more information. As Billy and Edna shared, that there's a lot of work that needs to be done to make sure that we are supporting tribal communities across the country. Thank you so much, everyone, for joining, and be well. Thank you.
Thank you. Thank
Take
you.
care.
Bye. Take
Bye-bye.
care.